was like, there's no way I have cancer, you know, the big C word.
First diagnosed at 13 years old. Years later, the cancer came back. Coming up, the treatment that led a young woman to stay true to her religious beliefs. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Sydney Jehovah needed a medical team willing to get creative with her cancer care. Due to her religious views, she cannot receive a blood transfusion. Before we check in with where Sydney stands now, let's take a look back at how the University of Kansas Cancer Center matched her medical and her spiritual needs in this installment of Where Are They Now? Today is a reason to celebrate, but it's been a long road to get here.
I remember honestly thinking that someone had switched my sample.
At just 13 years old, Sydney Jehovah got the news no teen should ever hear.
I was like, there's no way I have cancer, you know, the big C word.
Diagnosed with ALL, acute lymphoblastic lymphoma, a type of blood cancer, Sydney spent the next several years homeschooled, getting chemotherapy treatments, and fighting for her life. 3 years later, at 16, she was in remission, but that didn't last. At 19, her cancer was back. That is when she was referred by her doctor to the University of Kansas Cancer Center.
He said, you know, I don't know if we can do anything here for you, but let me make some phone calls. So he called and they said, well, we have this new treatment available and we're taking patients for CAR T therapy.
And that is when she met Dr. Sunil Abhyankar.
She came to us quite ill and her leukemia was resistant to chemotherapy.
He explained to me that they, you know, extracted T cells, re-engineered them, put them back in, and then those T cells would fight my specific cancer.
And it turns out not only was CAR T therapy the best route for Sydney medically, but also spiritually.
Because I am one of Jehovah's Witnesses and I don't take blood transfusions.
With Sydney's beliefs as a Jehovah's Witness limiting her treatment options, the Cancer Center team got to work figuring out the best way to treat Sydney while avoiding a blood transfusion. CAR T therapy allows for that. Doctors use a patient's own cells to treat and help kill the cancer. 6 months later, Sydney's cancer is gone.
Bone marrow looks great, okay?
Okay.
So congratulations.
Thank
This is
you.
fantastic.
I just hope that someone can look at my story and have a little bit of hope and realize that this could work.
This was a remarkable day for us. I mean, to tell her that 6 months out from the CAR T, she is in complete remission, no evidence of the leukemia, and this is truly exciting.
So that was back in 2019, and we are so happy to have Sydney back here with us this morning. How are you?
Good. Thanks for having me.
Do you remember that story we did all those years ago?
I do. It's crazy to look back.
It is. It is.
Yeah.
Well, excited to hear how you're doing now. We also have Dr. Sunil Abhyankar here with us. He is a hematologist and medical oncologist at the University of Kansas Cancer Center. He's also the director of the Midwest Stem Cell Therapy Center. How are you, Dr. A?
Good morning. How are you?
Good to see you.
Good to see you.
It's good to see you two back together again. Sydney, I want to start with you because we watched you bang the gong back in 2019. That was after your second round of cancer, but that certainly was not the end of your journey. So after that story, pick up where we left off.
Yeah, unfortunately that wasn't the end. I ended up going back to Wichita and I became a surgical technologist, and I spent about 2 years there working, and then I decided to become a traveling surgical technologist. Unfortunately on my 4th travel assignment, I started experiencing symptoms again. I had some extreme back pain, my legs began to be like tingly and numb, and then at one point I lost control of my bladder, and so I went into the ER, and they ended up finding a mass that was pushing on my spinal cord, causing those symptoms to occur.
So it was back.
Yeah.
Then you shared some photos of you in the hospital recently. Tell us a little bit about what you were facing at that moment and what kind of treatment you were getting and what they were telling you.
You know, right after they told me what was happening, they told me I had to go into surgery right away, whereas before my cancer was free flowing in my blood and my bone marrow, whereas now it had presented as a tumor, which was new for me.
So Dr. Abiyankar, so this was technically round 3 of Sydney's cancer. How common is this type of recurrence with her particular type of blood cancer?
So the recurrence is quite rare with acute lymphoblastic leukemia, especially when it occurs in children. There's like 80–90% cure rate.
So this was rare. We were on round 3. Tell me a little bit about this type of cancer so people understand what it is. Is that rare as well?
Yes, in adults it is rare. Acute lymphoblastic leukemia is more common in children, but then adults can also get it too. The prognosis is worse in adults than in children. So whereas in children, with the success of all the treatments that we have, there's a 80–90% long-term success of treating it. But in adults, it's about 50–60%.
So you had to go back to work. And Dr. A, what options, though, are there for patients like Sydney who've previously gone through cancer treatments, but now here they're back and they need more? What are the next steps? What are you trying to figure out?
So the remarkable thing that's happened in the last few years is the development of the CAR T-cell technology. So in CAR T-cells, what is done is we use a person's own lymphocytes. T-cells are a type of lymphocytes in our blood, and they're genetically engineered to insert a gene into them so that now these cells recognize the B cells, and they can go after the B cells and destroy them. And the B cells are where the leukemia is residing.
So that's what she did first, right?
That's what she did first.
And is she able to do that again if it comes back?
Yes, it can be. It's doable again, but now we have to target a different protein, a different antigen on the B cells. So once you've targeted one particular protein on the B cells by the CAR T cells, and then the leukemia relapses, unfortunately, then often it is not amenable to the same kind of CAR T treatment again, and we have to try a different mode of CAR T cell.
You were also able, though, to enroll her in a trial. Tell us about that.
When Sydney first got her CAR T cells, at that time it was approved for people who are of her age at that time. And at that time it was not approved for adults. So in that sense, we are lucky that we had that FDA approval to do this. But subsequently, when her leukemia relapsed, we were able to put it back into remission by giving these antibody treatments. So we didn't need to go back to doing another CAR T, but we embarked on treatment with antibodies. And these antibodies, what they do, they're called BITE antibodies, B-I-T-E. They're bispecific. So they attach to 2 proteins on the lymphocytes. So they take the T cells and they attach them to the B cells and kind of bring them together to kind of form of synapses, and that then triggers a T cell to attack the B cell.
Thank you for explaining. It's so fascinating how that works. And we talked about how creative your team at the Cancer Center got, and that creativity was needed due to your religious beliefs. So educate us a little bit, if you would, Sydney, about Jehovah's Witness. They believe blood to be sacred. Give us a little bit of a religious education this morning.
Yeah, blood is very sacred to me. You know, I take the Bible's advice at Acts 15:29, so therefore I abstain from using any blood products personally, which can pose as a difficult challenge for my care team to treat me when my blood counts are low.
So when they came to you and said, we have an option for you, you must have had questions. Tell me what that was like back in 2019.
What I really wanted to know was, can I receive this treatment and still stay true to my beliefs? And I was able to, and I'm very grateful that I had the option.
Yeah, that must have felt really good. Yeah. Do you ever get people who don't understand, maybe have misconceptions about faith when it comes to kind of faith and science and trying to find that delicate balance?
Yes, I think a lot of people think that that I would easily sacrifice my life for something that's known as a basic standard treatment for most, to have a blood transfusion. And the truth is that I'm very involved and concerned with my own health and my well-being, including my spiritual health, including my mental health. And I've been very fortunate to find a team and a doctor like Abiyankar who can meet both physical and my spiritual needs. And for that, I'll always be grateful, and I would not be here without them.
Had you come across that in a patient before? Was that a unique that must have been somewhat unique.
Yeah, so we were, with the advances in science, technology here, we could avoid treating Sydney the first time when a leukemia came back with giving chemo, and that would have dropped her counts, and we wouldn't have been able to do that because with that treatment she would have needed blood transfusions, platelet transfusions. And with the CAR T, we were fortunate that her blood counts did not drop very low, and she did not need any transfusions during that process. And similarly, when a leukemia has come back the third time, and we used the BITE antibody, similarly did not result in a significant drop in her blood counts. So we were able to go through this without major issues with having very, very low blood counts. Our blood counts did drop, but not to the extent where you need transfusions.
So do most leukemia patients, though, end up needing a blood transfusion, need blood product in some way? I mean, because
Yes.
we're talking about a blood cancer.
That's right, exactly. Especially initially when folks have diagnosis of leukemia, the bone marrow is packed with these cancer cells. And so when you start the treatment, all the counts drop, and you need many transfusion, blood and platelet transfusion support to get through all this.
So will you ever, so if Sydney can't take blood, are you ever going to run out of options? I mean, that's a fair question at some point to say,
Yeah.
What else, how is this going to affect her long-term treatment plan?
It is. It's a very good question. And knock on wood, hopefully we have the cancer in remission, on the run for a while, hopefully a long time. Hopefully it never comes back. But that is a very pertinent question, that if it does come back and we have a CAR T cell option, but we may at some point run out of how we could treat if it keeps coming back.
Well, if the science keeps improving, you
Yes,
just have to
yes.
keep up with it. But we're counting on this being third time and done.
Yeah.
Third
No
time
more.
and done. Let's talk about you two for a quick minute, because when you and I caught up, I know he's like
Yeah.
your favorite. We were talking on the phone the other day. I know, just to give you a little heart to Dr. A. She goes, oh, this is what she said on the phone to me. She goes, oh, Dr. A, she goes, nothing can ever happen to
We
him.
must protect him at all costs.
We have to put bubble wrap around Dr. A, because you said, you go, that is my guy.
Yeah.
Tell me, I'm going to let you just have a little moment to share your love for him.
No, I love Dr. Abiyankar. There was a story one time where he had a buckeye, one of those little buckeye seeds, in his hand, and it was a really rough day in the office for me and Dr. Abiyankar, because it was kind of bad news, and we were trying to find the antibody treatment. We were kind of in between everything, and I was getting ready to face another round, and we weren't sure how things were going to go. And he brought me this buckeye seed, and he said, people say this is good luck, and I want you to have it, So I still have it in my car.
So tell us about the buckeye seed. What is it? Where does it come from? And why is it good luck? Because I want one.
Actually, it was given to me by one of my other patients. Yeah, he said, Doc, keep this for good luck for you. And so it happened that I was seeing Sydney next, and I said, we need all the luck here. So
Yeah, he said,
And you
I
still have
want
it.
you to have this. Yeah.
And it does. It's that bond and that connection. I know we were talking about how important your dad, we saw your dad in that video, and he was there right along by your side the whole time, and the connections that you make along the way. Just talk about how important that is for you.
Yeah.
Any other thoughts about that? Just the team and
I've had such a good support system. I have such a good team. I'm just very grateful for everyone involved. My family, my friends have stuck there right beside me, but for every cry, every laugh. I have a really good team, doctor and family, and I thank God for giving me the strength to go through it yet again.
yet again. Like I said, last time, but you're still going to keep coming back. In fact, you came back about a year ago, and we caught up with you. I think we have some video of you in clinic. Tell me a little bit about what you were doing here and where you were in your checkups and your journey.
I think at this point I was in remission here, and it was just another checkup and whatnot. But yeah,
There's your hug.
I had to get the hug in, yeah. But yeah, and as of right now, I am in remission, and my leukemia is at bay. And we do checkups every once in a while just to make sure everything's okay. But I've been able to go back to my regular routine I'm back to being a travel surgical tech. I'm back helping patients where I feel most comfortable being. And yeah, everything is good right now.
And this path as a surgical technologist really was set in motion through your own personal story. Tell us about that, because we hear that a lot.
Yeah, no, I always, since, when I first initially got diagnosed, I was 13. And so, I got over that first round when I was about 16. And so I was getting ready to kind of make a decision of what I was going to do for a career option. And I knew I wanted to be in the medical field, mostly because I had been taken so well care of in the hospital. And I thought, I like what they're doing. I'd like to give back and do this also. And so I thought, oh, do I become a nurse? But at the time, everyone was becoming nurses, and I wanted to be a little different. So I looked into surgical technology, and it was so fascinating to me how we fix people in the operating room. And so I chose to do that.
And you have a lot to share, a lot to offer patients going through that, and a lot of hope. You also shared some photos of you just traveling, back living life again. Where are you?
Yeah. So like I said, I was able to go back into travel surgical technology, and I have gotten to go. I've now just completed my 5th travel assignment.
Is that up north?
That right there is in Spokane. That was in Wyoming there. I've been able to, I started here at KU, which was a very interesting experience where I got to work where I was treated as a patient. And then from Kansas City, I went to Spokane, Washington, Chico, California, and then I went to Ogdensburg, New York, and then Wyoming.
And now you're back.
Yeah.
Back with us.
Back.
Dr. Abiyankar, you treat all sorts of patients, all different age groups, but there's got to be something really special about someone like Sydney for you to watch her. She's diagnosed at a young age. That's always difficult to watch someone face that. And then just to see her kind of just plowing forward with life and kind of grabbing it by the tail. What does it mean to you to see her sitting here today?
Oh, it means a lot. I mean, just 10, 15 years ago, we wouldn't have all this at our fingertips, so to speak. And the amazing thing with Sydney is that she's optimistic all the time. She has a good spirit, and she's always joking in spite of, even if she hears bad news come through her, she always finds something to laugh about. And her family too, they're just so supportive.
Right.
And she's just amazing. She's an inspiration for many people.
Yeah.
And she probably doesn't know that, but she truly is. And the other thing is, when she says she thanked me, but she really thank the whole BMT team, right? Because we can't do this by ourselves. There are scientists involved. There's a lab that is involved in manufacturing the CAR T. Technicians, nurses.
Give me a number about how many people are truly back there on your team. Dozens?
Oh, dozens.
Dozens.
Yeah, dozens. Yeah. So we really do thank everybody that make this happen.
And Ellen, if you're listening, shout out to you. Yeah.
All right, nice work, Ellen. Okay, if you have questions for Dr. Abiyankar or Sydney, be sure to get those in. Use the chat feed there on YouTube or Facebook. You can tweet us or email us at the Medical News Network. Info is right there on your screen. Let's get a quick check on our COVID count with Dr. Dana Hawkinson joining us remotely today. Good morning. How are you?
Yeah. Hi. Thank you. Yeah, I'm sorry I can't be there. Having known Dr. Abiyankar for quite a few years now, just a wonderful physician in person. So very lucky for sure. Right now for our COVID cases, we are holding steady. We are still under 20, which is always a good thing. So 24 total, but 13 active. Unfortunately, 4 in the ICU but 0 on the ventilator. So numbers are good, Jess. We've talked about wanting to get down to 0 for sure. Hopefully we are headed that way. And as we get into these continued warmer months in the summer, we will continue to go down in those active cases.
So answer me this one, Doc Hawk. So the COVID pandemic, as we know, changed things for RSV. There's a what's called a normal RSV season, but starting in 2020, the timing seemed a bit off. We know RSV vaccines for some adults are coming soon. So what should we know about RSV season and the vaccines on the way?
Yeah, the RSV season did shift initially in the pandemic. This was not only true for the United States, but for other countries such as Australia as well. So we are getting back now to more of a seasonality with these respiratory viruses, especially RSV. And I think we need to keep that knowledge with us and understand that we can have these shifts, but hopefully we are getting back to a normal seasonality. What does that mean? That means for those patients that are at highest risk, such as Dr. Abiyankar's patients, those people, especially if we're talking about RSV, the very, very young, under a year, especially under 6 months, and the elderly, especially over 65, and those people that are immune compromised, like those patients that we see and we treat with Dr. Abiyankar and his teams, need to be acutely aware of that and take those precautions. Again, it is always safe to wear a mask. Remember to do hand hygiene, and just understand those situations that you go in as we start going into these cooler months in a few months. But I think it is important also that you mentioned we do have maybe protections coming down the pike and maybe will be approved for this next season. That is at least one, if not maybe two vaccines for the elderly, and also a vaccine for mother that she can get during the late stages of pregnancy to help boost an immune response and then provide that immune response to baby while baby is still in the womb. And then when they are born, they have those protections.
All right, Doc Hawk, good to see you this morning. We'll see you back here in studio very soon.
Yes.
Do we have any reporters with us today? Okay, let's get to some community ones. Yen Liang wants to know, compared to CAR T and blood transfusions, which one is better for blood cancer?
So blood transfusions are needed just to support the person going through the treatment. It's not the treatment, it's supportive care. And the CAR T cell actually is a curative part for the treatment of the blood cancer. So we have the T cells that are obtained from the person, and they're engineered so that they now can attack. They see B cells and go after them and kill them. But going through that process, you're going to need a lot of support for transfusions and blood and platelets, etc.
There are many types of cancers in the blood system that can occur. What kind of patients are suitable for CAR T therapy?
So currently the FDA has approved CAR T cell for relapsed leukemia, like Sydney has had rather, and relapsed lymphoma and multiple myeloma. Those are the three main indications that have been FDA approved, but there are plenty of other research studies that are going on in many other cancers, colon cancer, lung cancer, breast cancer, melanoma, and even some non-cancer conditions like rheumatoid arthritis, lupus, myasthenia, where CAR T cells are being tried in a clinical trial right now. But the hope is that in a few years we'll see many of these cell therapies make it to the clinic.
It'll be the gold standard?
It will be, because the more, as we look back, we're getting away from giving more and more chemotherapy. Because chemotherapy is all the side effects and dropping counts and neuropathy, damage to the kidney, lung, heart, etc. And we really want to get away from that. And there are long-term complications of taking chemotherapy. So CAR T cell hopefully will avoid all those things.
And that was another part of a question was, do we ever think chemo will just simply go away?
That's where we're headed, yeah. Okay. We may not get completely away from it, but it'll be a much milder doses than what we are
less damaging.
Less damaging.
Polly wants to know, Sydney, how have you tackled the mental challenges of being diagnosed at 13 and then back at 19 and now at 24? How have you handled that? What advice might you have for someone?
In some ways it's gotten, easier. In some ways it's harder. Easier in the sense that, I have done this before, and so I know how to take care of my body, whether that be, keeping my hydration, nutrition levels up, just to take care of, myself. And then in other ways, it is hard mentally because it's dealing with the same problem over and over again, and it can get very disappointing and discouraging. And that's why, for me, faith, my support system, and now KU has provisions for patients like therapists that are especially for patients that are undergoing treatments, and so between all the provisions and support system and faith and things like that, I've been able to do all right.
Your advice is to take advantage of all of those things laid out for you, because you're going to need them to stay strong. Joe wants to know, Sydney, if you could explain what CAR T therapy felt like what you felt like? Could you feel it? Did it hurt?
I've had both. I've had, the traditional chemotherapy, and then I've had this immunotherapy now. Night and day difference. The infusion itself for CAR T is like 15 minutes. Before patients take the CAR T therapy, you're told about all the, possible side effects. Neurotoxicity, cytokine release syndrome, you could hallucinate, forget who your parents are, some go into comas and whatnot, and so I remember being really prepared for those kind of things. And after I got the infusion, I didn't even get so much as a headache. And I remember trying to convince Dr. Abiyankar that it was not working for me because I did not even hallucinate one time. I didn't. And he assured me that that's not always the case, and that to wait the 30 days to take the bone marrow biopsy. And then I ended up being in remission. So I was so shocked at how well I was doing on the treatment because I was used to traditional chemotherapy where, you are on constant anti-nausea medication. You are in the hospital for random complications due to the chemotherapy.
You have to feel bad to feel like it's working.
Exactly, and that's what I was used to, and that's why I was surprised how well I was doing on the treatment.
Dr. Abiyankar, just last question. Do we know what causes these types of blood cancers, hers in particular, but any, really?
In short, we really don't. And that's where it gets to how can you prevent these diseases from happening. And but many, it's probably not one cause, there's multiple causes. Maybe sometimes it's a virus infection that triggers an immune response that leads to the cancer. But we don't completely understand how majority of the cancers occur. In some, it's obviously obvious, smoking history, or exposure to chemotherapy in the past, or some people have exposure to toxic agents at their job or something like that. So those are known associated, but in the majority of instances, we really don't know what caused the cancer.
Hereditary at all? Do we know?
Yes, there are a small number of people who have it from hereditary, yes.
Well, before we get to our takeaways today, just a lot of really great well wishes and just people appreciating you sharing your story and just wanting you to get well and live well. So thank you for that. Dr. Abiyankar, I'll start with you. What should the takeaway today be from this conversation?
So the takeaway is that we have many options of how we can treat cancers, blood cancers especially right now, but all types of cancers. And coming to an institution that has these facilities, to do this, has clinical trials available, has the team that is needed to take care of these complex situations, is where people should go to if they have, unfortunately, they have developed something serious like that.
All right, what's our takeaway? First of all, thank you for sharing your health story, your religious story, just educating us and just being so fantastic. What do you want us to know?
I want everyone to know about these new immunotherapies. Like I said, night and day difference between the treatments I've had in the past. And just my gratitude for Dr. A and his team and everyone, and my personal support system, and my faith in God for helping me get through it all.
Great. Where are they now story, but I want you back again.
Yeah,
okay?
Yeah.
Doing great, doing more cool stuff, sharing great pictures. So thank you again.
Yeah.
Thank you to you both.
And
thanks to our guests, of course, and we will see you back here tomorrow at 8 a.m. Coming up tomorrow on the Morning Medical Update, the toughest question to hear from a daughter to her dad, am I going to die? Even harder was the answer. I'm Jessica Lovell on the next Morning Medical Update. Only 8% with this aggressive colorectal cancer survive. How this daughter beat the odds and forever changed her bond with her dad. Tuesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.